Yeah. Hello, good evening again. So this section of tonight's talk on the thyroid health, I'm going to talk about a thyroid disease, low thyroid. Just because of all the things with the thyroid, this is probably one of the more common things that I see in the clinic as well. And so basically, as mentioned in the last introduction presentation, low thyroid or hypothyroidism happens when the worker is just not doing its job, or somebody's trying to take away the thyroid chemicals or hormones that it's trying to push out. And so the thyroid hormones, that's essential for a whole bunch of things in the body. So it's essential for your digestion, metabolism, hair production, all sorts of things, including for the ladies, menstrual irregularities and such. And so basically, when the thyroid goes out of whack, it is a whole body kind of thing. And some of the more common symptoms of having low thyroid is first goiter. So the thyroid that lives here, it swells and it gets a little bit too big, and sometimes you can really look at someone and see like an extra pouch there when it gets to be more significant. So goiter is swelling, a dull facial expression, so people just kind of a little blah in their facial expression. Drooping eyelids, sometimes the eyelids can be a little on the droopy side. Speech, so sometimes people's speech can go from their normal timbre to being a little bit hoarse, which I'm not going to try to demonstrate. I was doing that last week. Thinning or dry, brittle hair. So the hair can get very thin, it can get dry, brittle. The eyebrows, especially the outer part of the eyebrow, can start to disappear. Dry skin, which can be difficult to distinguish in the wintertime when it seems like everybody's skin is kind of getting dry. Swelling of the skin. So we fancy Latin word for that is myxedema. So basically in the front of the lower leg, right along that shin bone, sometimes when the thyroid hormone is down, then people can get swelling, and you can actually put your finger into the skin of that area, and if it leaves an indentation that you can kind of feel afterwards, and that's a sign of the swelling right along that shin bone. Menstrual disorders, as mentioned, the periods could be hard, heavy, and fast, or they can be really spaced out. Everybody responds to it a little differently. The heart rate can slow down with a low thyroid function. Constipation, again, slowing things down, so it causes the colon to not move things through as quickly. Depression, it also causes fatigue, and people feel kind of and down, and just kind of overall depression. So when people come in for depression, sometimes one of the first things they want to double check is just to make sure, is there a biological cause like the thyroid that we can fix easily. Tingling, numbness, tingling in the fingers and other body parts. Trouble with the coordination, just feel a little bit more fumbly than usual. And anemia. So this is one of those symptoms that sometimes if someone is anemic, it can trigger the thyroid to be a little bit out of function, and sometimes if the thyroid's a little bit out of function, it can cause anemia. So anemia meaning you're not having enough blood in your body. And so most of the time low thyroid happens in women, and it can happen in men as well, and the risk of it gets higher the older the person is, though it can happen really at almost any age. There's a few genetic things, and one of the other things that's a risk factor is obesity, and that may also be a symptom of the thyroid, because when the thyroid is not working at its full capacity, it's a little bit easier to gain weight and keep it stuck on there. And the main way to diagnose a low thyroid function is blood work. Sorry guys that are afraid of needles, but just a little bit of blood, send it off, and a couple hours later, or days depending on which lab you're going to, you find out your TSH and free T4 values. So the nice thing about most labs is there's something called a reflex TSH, So the TSH is that boss hormone. If you go back to the introduction, that boss hormone, if the boss is happy, sometimes we don't even look further. We just say, boss is happy, everything's okay with the thyroid. If there's a certain reason to go looking further, like say the TSH is too high or too low, most labs have this reflex, oh, it's out of whack, let's go double check and see what the worker's doing that made the boss unhappy, so to say. So occasionally we'll order things like ultrasounds of the thyroid, especially if we feel a nodule or if there's a family history of thyroid problems. And so, of course, this is a very general talk, so those kinds of details, talk with your own physician about, please. And basically, the treatment, if we decide or discover that the thyroid hormone is too low, like the worker is not doing its job enough and we need to get a little bit more thyroid hormone going, is a little bit of thyroid medication. So a couple of pointers on that thyroid medication. The most common one currently is Thyroid, and then there's a couple other generic brands of that levothyroxine. So a few details with that. The Thyroid is very, very standardized across the entire country. You can go to a pharmacy in Maine and take it, and you can go to the pharmacy in Florida and take it, and be very sure that whatever that dose is in the pill is going to be standardized wherever you go. And the generic version of that, the levothyroxine, it's made by different companies in different parts of the country that service those areas. And so if you get it in Maine and you're used to being on a particular dose and then you move to California, it's possible that the number dose that's on your pill might change slightly because the manufacturer in California's version might be just a little bit more powerful than the people in Maine. I don't know if that's really true, but I'm just kind of giving an example. And so sometimes when people move from one area to another, if they're doing the generic version of that, they might find that they kind of don't feel as well on that same dose, get the levels rechecked about 4 to 6 weeks later, because it takes about 4 to 6 weeks for these numbers to be influenced by the medication. And then you can find out for sure, hey, do I need to readjust the dose? At one of my previous places that I worked at, the way our pharmacy solved that was they said, forget it, we've been doing too much monkeying around with these doses, we're just going to order the Thyroid for everybody. So that was a decision. It was a little more pricey than the generic, but that was something they found was cost effective for them. There is a natural version of thyroid available, and my experience with that, and my pharmacy friends kind of have told me they agree as well, is that the natural thyroid hormone that is made from ground up cow thyroid, and in each capsule the amount of that active thyroid hormone can vary tremendously. So you've got the same bottle, the same strength, so to say, and one pill has a little bit, one pill might have a lot, one pill has somewhat completely different dose. And so the levels can really fluctuate quite a bit, and it's in an unpredictable way. And so some patients report that they kind of feel better on the natural medications as opposed to the others. I can't speak for that subjective experience, how true it is versus whether we expect it to work better so we feel it works better. That placebo effect sometimes happens too. So this is, again, things to talk with your individual doctors about, please. But that's the medical concern about the natural version of this, is that the levels are just kind of way too fluctuating. So if you thought that the company generic fluctuate a little bit between, say, Maine and New Hampshire or something, the levels of this iodine bovine hormone thyroid supplement can vary quite a bit as well. And so it's just something I have not had as much experience with, just because I do not usually recommend it as well. Next, oh yes, so other things you can do with the thyroid medication, regardless of which particular version you're taking, it's very important to remember to take it first thing in the morning on an empty stomach. Why is that? Because immediately a few hours before you're actually waking up, your body's producing all sorts of different hormones to just kind of get the juices going and kind of get you ready to get up there and face the day. And a little while before you wake up, the thyroid naturally has an increase in production of that hormone that spikes shortly before you get up. Obviously, we're not going to have you wake yourself up before it's time to wake up. So first thing in the morning, I usually recommend having the thyroid hormone pills sitting on your bedside or as close to there as you particularly care in your own life situation, and a cup of water or something right there, and literally wake up, take that pill, and let it go down to the stomach. And then wait at least 30 minutes before you eat anything else. The reason for that is the way that the thyroid hormone is absorbed. If you have an empty stomach, it's absolutely the best for the thyroid hormone absorption. If you got anything in the stomach, it really decreases the body's ability to absorb that. So occasionally people will take it and then they'll have breakfast right away, or they'll kind of be a little not as, disciplined, like every day about the same time, kind of taking it a little more haphazard, if you would. And if there's food present in the stomach, immediately when the pill is trying to digest and be absorbed, then it can really change the way that it's handled by the body. So best to be consistent, and the absolute best is to try to mimic what the body is trying to do in the first place, which is immediately first in the morning, drink it down with a glass of water, and then do something else, use the bathroom, take a shower, whatever your morning routine is, and then have some food after that. So we talked about having a good source of iodine, regardless of whether you're using the salt or the little bit of seaweed variety, as a prevention for helping to prevent that low thyroid. It's very common that when people have antibodies against their thyroid, which is called Hashimoto's thyroiditis, is the most common cause of low thyroid function, that these people very commonly might also have antibodies against other things. So for example, they might have antibodies against their gluten, which is something that is found in a lot of foods. And so some people with low thyroid should be screened for celiac disease, and that's the real reason why I see all these gluten-free items out there. They originally were designed for people with this very specific antibody against gluten, and so not everybody, but some people with thyroid disease might consider getting screened for a celiac, or might consider doing a brief trial of a gluten-free diet for maybe a couple weeks or something like that, 2 weeks, 1 week, and just kind of see if it makes you feel better. And if you feel like, wow, this is amazing, then you might want to consider, again, a conversation with your physician and checking as well. Especially for the women, iron deficiency is another thing that can happen. So if a woman is menstruating, especially if she happens to fall into those people that have really heavy periods as a result of the thyroid being out of whack, they can lose a lot of iron faster than it's taken in. And so when the blood is being lost through menses, GI tract, bleeding from colon polyps, whatever way that the iron is being lost and not taken back in, it can also increase the risk for low thyroid as well. And so occasionally, when people were found to have iron deficiency anemia, looking at Dr. Barnard's website here, the women that had the iron deficiency anemia, they replenished their iron stores, and then their thyroid function returned to normal after that. So again, iron supplements not at the same time as the thyroid medication. Iron supplements, if they're used, they can cause constipation and can be very sometimes nauseating and stuff on the belly. And so for iron, I usually recommend lentils and dark green leafies. For example, I've got some rocket lettuce here, so arugula, a great source for iron. lentils out of all of the beans are the highest, followed by black beans and a few other varieties of beans as well. So, so calcium carbonate, so that's the active ingredient from Tums. Both that and iron really impair the ability of the body to absorb the iron when you're taking it, so that's especially important not to take at the same time as the iron pill. And sometimes older people had been taking calcium supplements and stuff. Per the new research, I don't recommend calcium supplements anymore, but that's a totally different topic. We'll talk about there another time. I have one more tip for you on thyroid function, and that is so-called goiterogenic foods. And so my arugula, awesome as it is, if somebody is not having enough iodine in their diet, because they're not using the iodized salt, they're not getting any seaweed, they're not using anything that gets iodine into their system, then sometimes the broccoli and the kale and all those other wonderful, what we call cruciferous vegetables, can actually block the thyroid's function a little bit. If you have a source of seaweed a little bit in the diet here and there, it can counteract that and make it so that the thyroid does not enlarge in the presence of these goiterogenic foods. So please go ahead and eat as much of that broccoli and kale and dark green leafy vegetables as you like, and just have a little iodine to go with it in the form of natural foods. Alrighty, so that's everything that I have for the low thyroid tonight, and I wish you well and happy conversations with your doctors. Okay, bye-bye.